So I'd like to welcome you and say good morning, and as we start our 59th Annual International Convention and Exhibition. These next 4 days will be filled with information that you need not only to remain viable as a part of the healthcare system, but as you go back home and you bring this information back home as well. We want you to be able to step out of your comfort zone and be leaders in a quickly evolving era of healthcare reform. And I believe now we have an opportunity for our patients and our profession, the likes of which we've never seen before and likely may not for some time to come. The Patient Protection and Affordable Care Act carries a mandate that specifies a change in paradigm from treating acute illness to including one of preventing illness before it happens. Most importantly for us, managing chronic illness is really important so that the quality of life of our patients can be maximized. When this bill was enacted, actually what we're looking at is our bill that was dropped this year at in Congress by John Lewis. And the bill is H.R. 2619. And it will assure that Medicare will reimburse respiratory therapists for disease management of patients with chronic pulmonary disease outside of the hospital. The Medicare Respiratory Therapist Act will be an important part of assuring that our patients and caregivers are provided with the necessary education and assessment and tools that they need to lead their life through self-management of COPD, asthma, pulmonary fibrosis, pulmonary hypertension, and cystic fibrosis. I urge you to join us as we reach out to Congress and we make this bill a law, and we do it soon. It's really as simple as going to our homepage, AARC.org, where you'll find a button that will navigate you to an area where there's just 2 or 3 steps where you can send a letter, an email to your elected officials. But we have another opportunity this year as well, and next year especially. In fiscal year 2015, less than a year from now, on October 1st, COPD will be added to the list of diseases and conditions that will be subject to the penalties for readmissions to hospitals within 30 days. Is there anybody in your hospital who is better educated and trained to help implement programs that can reduce COPD readmissions than the respiratory therapist? I don't think so. With millions of dollars in reimbursement to hospitals at stake, it's incumbent upon hospitals and respiratory therapists to step up and address chronic management of COPD. I urge all of you to seize this unprecedented opportunity to ensure that our patients and family receive care from the best qualified practitioners out there to deliver it, respiratory therapists. The AARC stands ready to help you as we put these programs in place. And again, I would direct you to our website where you can learn a little bit more about some of the best practices of respiratory care specific to COPD and preventing readmissions to hospitals. I urge you to become part of that effort as we really push this in the year to come. As a profession, this is our time to make a difference, to do what we do best, treating and educating patients so that they can better self-manage their disease. And then finally, before I close, I'd like to remember one of our members who we lost just a few weeks ago. Her name was Denise Adams. She was a respiratory therapist and AARC member who specialized in neonatal pediatric transports at Le Bonheur Hospital. Her life was cut short as a result of an in-flight crash. She, a nurse, and a pilot were all killed on their way to pick up a patient at an outlying hospital. To give you a better idea of who she was, I want to share just a couple of comments from a colleague of hers, Mitchell Mask, who told me that Denise was the most selfless person he ever knew. She was positive, she was caring, and she made a difference in the lives of the patients and the people that she worked with. She always tried to see the good in others. He said that she would give you a kidney if she was able to find a match for you. Denise, I've never had the chance to know you, but I can tell you that I'm proud that you so richly added to our profession and so importantly to our patients. Thank you very much.